Hello. I'm so sorry I'm late. This is our first live cast, and it's all new to me, so I'm trying my best to figure this out as we go along. I set up the live cast, and it didn't seem like I could do anything premature, so here we are. Um, I apologize for any problems that we may have in advance. This is all new to me. I was hoping to do well, this is the test case here. I was hoping to do a test case with some friends, but we've been really busy here. So let's see. It's all new to me, so I'm trying my best to figure this out as we go along. I set up the live cast and it didn't. Hello. Do anything. I'm so sorry I'm late. This is our first. So here we are. Live cast. Hold on a second. I'm gonna have to. I apologize. It's for all new to me, so I may have trying my best to figure this out as we go along. I set up the live cast. Well, this is the test. This is premature. So here we are. I was hoping to do well, this is the I apologize case for any problems that we may have in advance. This is all new to me. I was hoping to do well, this is the test case here. I was hoping to do a test case with some friends, but we've been really busy here. So you gotta go away, babe. Well, sorry for the pause there. So, back pain mastery, that's what this program is about. I'm not sure how you got here, but let me give you a couple of clues on how to stay abreast of what's going on. We have a Facebook page. That's probably the best place. If you put the words back pain mastery into the Facebook search bar on the top of your Facebook, that should take you to our back pain page. We've got over 2,700 followers and fans, and done that in just like 2 or 3 months, so we're kind of excited. There's other ways to get a hold of us too. If you want, you can text your name and your email address by contacting 503-438-4228, and then just texting us with your name and email address, and that should take you to, when you do that, you should get some information back that'll give you access to some videos and some information. If you have an SMS short code, you can put no back pain and then your name and your email address to 58885. Or you can call 866-63, I think it's 866-603-3995, and then use the PIN number 110311. So the program is a comprehensive program that includes all possible approaches to back pain, from a physical, mental, psychological, emotional, metaphysical point of view. This involves all the studies that I've done over the last 30 years on the subject. I started doing massage and psychotherapy around 1981, although I was in active therapy and performing off Broadway, doing authentic work around what was then called primal therapy. So my introduction to psychotherapy was working on pain issues, pain management, and also weight disorders. And I found two things. One was I'm a mover and a kinesthetic person, so it's hard for me to sit for long periods of time. So um, the idea of having consultations all day and me just sitting all day was not going to work for me. At the same time, I was connecting with chiropractors and inventors and finding products that I found to be valuable for alleviating pain. And I started taking those products to shows, trade shows, and events for the general public so that I could affect more people uh, in less time. So there are a lot of products that can help with your back pain. My number one advice is never give up, to persevere. And there's always something that can be done to help your situation. And um, yes, I have myself have had lots of back pain. It's usually that way. The teacher is teaching something they need to learn. So, of course, as soon as I decided to teach the back pain mastery course, I started having back pain, which I haven't had in a long time. The way I've handled back pain is by having some practices, some daily practices, some things that I do on a daily basis to prevent back pain. And I do have to say that I've created a lifestyle where I'm not at the behest of anyone else. I do have a lot of control in my life, and I would suggest that you might want to start thinking about that for yourself. So some of the areas where people have major issues, probably the one biggest contributing factor to back pain is sitting for long periods of time. The second would be work-related issues, truck drivers, people who transport things, move things a lot, people who are dealing with physical activities, uh, either business, work, or moving into sports and athletics. The sports and athletics back pain is usually acute, being it's a specific event, as opposed to chronic, which means going on for long periods of time with no specific event attached to it. Chronic back pain can last, forever. Sometimes it was started by an acute event, but there wasn't any relief from it, and it became an ongoing issue. So Dr. Sarno's work is something that you really should know about. I've mentioned him in the Facebook. He's written quite a few books, No More Back Pain, the mental issues of back pain. You can find him on Amazon. And if you look on Google, you can probably find the 60 Minutes piece that was done with him. That's fascinating, by a journalist who worked for 60 Minutes but has had a history of incredibly terrible chronic back pain, to the point where he would have to lay on the ground for long periods of time just to relieve his back. And Dr. Sarno more or less cures him. And the cure is basically knowing that back pain is very often a mental process. It's an idea that we get that seems to hold water, but it's based on inaccurate information. His experience is that 100 people could have the same diagnosis from a chiropractor or an x-ray, and out of those 100 people, 70 could have pain and 30 could not. And the 70 that do, if they take his course, I think he's got like a 90% or higher cure rate, their back pain will disappear. So my experience of Dr. Sarno's work, the one story I could tell where I realized what he said was so true, I was moving, and I don't remember how old I was, but I was probably in my 30s or 40s, and the day came where I had to move, and I had to rent a U-Haul. I was doing a lot of it myself, and then I had hired some people off the street to help me, and I had a lot to do, and I was managing the whole event. Of course, that the night before, I started having back pain. In the morning of the event, I could hardly move. But this was a situation where I didn't have much choice. So I got out of bed and what would you call it? I hobbled around the best I could, trying to tell people what needed to be done. I could barely bend over, so I couldn't pick much up. After an hour or two of that, all of a sudden my body started to coordinate, and before I knew it, I was actually doing things. And my experience of that was that we are um, psychosomatic beings. We have a mind, we've got a body, and those two processes sometimes are in conflict and sometimes are integrated. When they're in conflict, there's some kind of mismatch. So I didn't want to move. I didn't want to have to move, and I didn't want to do the move. So there was a piece of me that was not wanting to have to do what needed to be done that day. And the back pain was a convenient excuse to not have to do what needed to be done. But once I started to do it anyway, my mind, my unconscious, sooner or later realized that this guy's not going to stop. We can't stop him from doing it. We might as well let go of the notion of giving him pain and let him get on with it, what he's obviously going to do anyway. So the nervous system, the pain reference, the causes of pain are definitely hooked up with our unconscious. Yes. So I think I mentioned in Facebook one of my favorite books right now is called The Obstacle is the Way by Ryan Holiday, I think his name is. Incredible book. And one of the stories that he tells has to do with NASA and going to the moon and the astronauts that were involved in that program, and how they spent years going through every possible mistake that could happen in the process of launching a spacecraft. Everything from the time they got up in the morning, what they ate, how they moved, how they got to the spacecraft, and everything after that. Every possible which way that things could go wrong, and then they had to rehearse, re-rehearse, and deal with how they would deal with those situations. So when they finally took off, their confidence level was extremely high. They had already taken care of every possible iteration of a problem. They were practiced. I think of the Dalai Lama when I say that a lot of people like to put him up on a pedestal and consider him an amazing, wise man, which he is. But if you knew his practices, you would understand how he deals with a lot of these things. He's up at 3 o'clock in the morning, somewhere between 3 and 5 in the morning, meditating. And meditation is not just sitting, chanting, or looking at a candle. A lot of meditation is active meditation. So before he goes to see that person that he's got to see that he might not necessarily like, some person who's attacked him viciously in the paper, or is a communist or a Chinese politician, he's sat with that person in his mind, seeing himself meeting that person, feeling those feelings of anger and distrust. And he's worked through that. He's worked through that meeting to the point where he could move into that meeting with a sense of equanimity. That's a popular word anytime you're talking about the Dalai Lama. Equanimity meaning a sense of peace. And so he's rehearsed that. So how does that have to do with back pain? Well, a lot of back pain is situational. That's to do with a movement that you make or a posture that you get in. So you often don't get great feedback immediately from your body. So you can sit for an hour and feel like you're fine, or lay on the couch slumped over watching TV and you're not getting any feedback from your body. And then you go to get up and you can hardly move, or you have a sharp ache in a specific area. That's feedback. That's feedback that tells you that you need to start to rearrange the way you sit, the way you slouch, the way you watch TV. And don't spend too much time in any one position. The body likes to move. There's a gentleman who's writing a book right now. Mobility WOD. I think that's the name of his website. He's a physical therapist, an amazing gentleman, young guy, uh, who's in really great shape, but he's also really aware of the fact that sitting is not good for us. So the name of the book is called Sitting is the Next Smoking. I love that title. And the concept is that our bodies are not made to sit. The chairs we sit on were not designed for the human body. We're not designed to sit for long periods of time. It puts a lot of stress on the lower back, the hips, all our joints, our neck and shoulders, especially when you're on the computer. So what I recommend is if you do have to sit and you have a job where you don't have a lot of options, make sure you create situations where you can be getting up every so often, at least every 45 minutes. Something, whether it's the bathroom, getting a glass of water, maybe start making lists of excuses you can have to take a piece of paper to your boss, or have to get something from a file, or have to get a piece of paper Xeroxed. But you need to start thinking in terms of actively using your body all day long, not being in any one position for too long. How long is too long? That depends on your history, your well-being, your physical fitness. But ironically, some of us, the better shape we're in, the more problems we have. Our bodies won't tolerate unpleasant sitting. So I can't sit for very long at all, especially on a wooden chair. Sometimes I go to a restaurant and the chairs are terrible, and before I'm done eating, I'm starting to feel pain in my back. So I stand when I do my work. Ideally, I would have a standing desk, but at this point, I use anything from a kitchen counter to a bookshelf. Yeah, those are my two main options right now, to a desk with a bunch of boxes so I can get the computer up high enough. This studio here, as you can see, the background is in my basement, and I'm actually on a more Japanese style system right now with a little on my knees, which I have gotten used to, so it doesn't bother me too much. So I'll take some questions here. Okay, Matt asks, how do I get started? I have severe back pain from a number of accidents. Okay, so I think I've mentioned this before in the Facebook postings that I've done. Number one for all of you is to get a baseline. The concept of baseline brings this into a more objective setting. So an important part of reality is that there's usually two pieces to anything that happens in the real world. There's the objective event, and then there's our feelings and attitudes and judgments about that event. The problems exist on the second half of that. So a baseline allows you to get a sense of what is your movement range at this point in time. What is your body capable of? Now, if you ever have gone to a physical therapist, they have specific things that they do. They have like rulers, compasses, protractors to give. So if you move your body, what's the angle that you can move your arm to? And they measure all of those things. You don't need to be that extreme, but range of motion would have to do with lifting your arm, putting it over your head, your hands. What's your range of motion with your hands, with your fingers? Those things don't have to do with the back too much, but usually back pain is going to be things like reaching. So is it possible for you to reach without any pain? And if you'd want to see where you start to feel pain, and get really specific. So just sitting right now, if I bring my arm up here, I start to feel a little bit of a sensation in my right hip. Right arm, right hip. Let's see, left arm. No, nothing there, but I do feel a little pain in my shoulder. So I would mark all these things down, and I keep a chart. And then over time, I would see which things are common and what can I do about those things. So how are those things changing over time? So you want to be dedicating yourself to having some practices that will increase your range of motion, and then knowing, oh, the other part is what positions tend to cause the pain. Are you always in pain, or are there any positions that allow you not to feel the pain? So some people are going to be, there's three postures where I experience pain. Whenever I sit, that would be the main one probably. Um, and so then you would want to find ways of not sitting, and then also ways of sitting where you don't feel pain. Uh, if you feel pain whenever you sit, then you would definitely try to figure out a way not to have to sit. Um, the question becomes, how much do you care about getting rid of your back pain? For some people, it might actually mean not doing the job you're doing anymore because it creates the pain. Um, that's an extreme situation, but there are going to be some decisions you're going to have to make about how you're living your life and how you're contributing to your back pain. Um, the more positions that you have where you, so if you're in chronic back pain and it's been there for a long time and it's almost always there, do you ever find relief? Usually people will have some answer that's yes, for sure when I'm sleeping. Laying down is usually a good one. The fetal position, you have to see, some people would be lying on the back. Usually lying on the stomach is hard. But if you lie on the back, some options are to put a bolster or some kind of a pillow underneath your knees. That takes a little bit of stress off your lower back. Something underneath the crook of your neck. So we have pillows, but sometimes the pillows just basically lift our heads and cause strain rather than extension. Your optimal situation with your body is to have some sense of extension. So your neck is long, your spine is elongated. Yeah. So find the postures that you feel comfortable and feel no pain. Find the ones that you do feel pain and find ways to avoid those. Get a baseline. And then by watching this program, start to develop some daily practices. My most important daily practice is the Yamana body rolling. So you can go to allaboutbodyrolling.com and see it's a system of using balls that are massage balls of different sizes that have a certain texture to them so that they really tend to facilitate muscle release in the body. And I roll on those pretty much every day. And there's foot wakers and foot savers that are hemispheres that you stand on that work on the feet. So the whole body is connected. The feet are connected to the legs, and our feet are really critical in terms of the health of our backs and the rest of our bodies. Yeah, so I don't want to make this first one too long because I want to just introduce you to the program, get you on the Facebook page, and let you know what we're going to be doing over the next 6 months. It's going to be an ongoing program, so it's going to go on for, I don't know, hopefully forever. But I'm going to be having experts in different fields come on and talk about their expertise. Feldenkrais is a system that I find really valuable. It's a system of working with the body that's really simple, gentle, and very easy. Anybody can do. There's a body rolling. There's chiropractic. There's acupuncture. There's physical therapy. There's functional fitness, which would be a form of training. There's the metaphysical approach to things, which is more or less the notion that when we have a pain in a certain part of our body, it's associated with some metaphysical piece. So lower back is usually considered financial security. It's the foundation of your being, and that's associated with your financial well-being. So that might be a way to look at it. And then there's also a whole, there are various psychology approaches to dealing with back pain. process-oriented psychology, behavioral psychology. We'll talk about different ones and how they can help you with your understanding of the back. Then there's also pharmaceuticals and tools for healthy backs. So some tools, electrical massagers, handheld massagers that can help to work out some of the muscle issues. Anatomy, physiology, so understanding the fascia, the muscles, the joints, how they work together, and the vertebra, the discs, and hydration, how to keep your body filled with water. So I think I mentioned that there were going to be 3 things on here to help you avoid back pain. So the first one would be finding, just so I'm clear about naming these things. The first one was what I said before, finding the things that cause you back pain, doing less of those, or modifying those. Find the things that cause you comfort, doing more of those, creating a baseline. So you have some way of knowing how you're getting better and what you're doing to get better. So those would be the 3 things. Yeah, I think I'm going to leave it at that and give you these numbers again. So give me some feedback, get me some more questions about what you're interested in and what you need help with. And go to the Facebook page, Back Pain Mastery. Text your name and email to 503-438-4228, and that should get you some free videos and maybe even a document that helps with what muscles you need to work on to relieve the lower back. Okay, I think that's about it for today, and I thank you so much for hanging out with me, and let's see how we can move forward together and take care of your back so you became a master in your own back pain and that of those you love and care about. Tell your friends about the video and the Facebook page, and I will see you again soon. Let's try and do this again. Let's plan on next Thursday at 4. I'll be posting on Facebook page to let you know when that will be, but we'll try to do 1 event a week. Okay, thanks.